Is fear of sexual activity with curvature something that you commonly see? Is it warranted? And if so, what are some of the risks of sexual activity when a man does have a curve in his penis?
I would say reticence is definitely present. So a lot of times, what will happen is the man doesn't want to initiate or engage in intercourse because they're worried. They're worried how it's going to be perceived. They're worried they're going to lose the erection. They're worried the partner's not going to be satisfied. Interestingly, there was a study years ago where they quizzed men with Crohn's disease and said, "How much does this bug your partner?" And they said dramatically, like 90%, absolutely. It's a huge deal. They quizzed the partners, exact same question. They said, "Oh, I couldn't care less." And so it's very much a condition. And the guys will know that. They'll know that, this is my internal perception, but it still really bugs them. And it's something that's important to them. So that, the reticence to engage in relationships is huge. And then you can imagine that, like if you were reticent to engage in a new relationship, whether it's sexual or non-sexual, that has a big impact on kind of humanity in general and satisfaction, life satisfaction, other things.
So that's on the reticence or the concern about the impact on the partner, which I think oftentimes men are overestimating the role of the appearance of their penis, the length, the girth, the curve, all of those things. And I think study after study do demonstrate that. Now, with the curve, though, are there medical risks or concerns to engaging in partnered sexual activity or even in solo sexual activity, masturbation? Are there things that men are at higher risk for as a result of having that curvature? And obviously, it all depends on the degree. I want to be clear. Like not all curve is the same. But what are some of the concerns, or what are some of the things that men would have to be mindful of or be a little bit careful about?
It's a real common question that we get. And usually the way guys will pose it is, can I still continue to have intercourse or do I need to stop? And the problem is, let's say you said stop. Well, that's the end of your visit, and that's it. And so generally andrologists or those who specialize in it never restrict it and say you have to stop anyway. We just usually say you want to make sure that the erection is as rigid as possible, that you're using lubrication, that you're being real careful with it. And then, like you said, it depends. If someone has a curve near the base with hourglass deformity and real severe curve, they're going to have a huge problem with buckling. And the rigidity of the penis beyond that area is going to be very minimal. And so that's going to be a high risk person. And then you put that with high risk behaviors where partners on top, for example, where it's going to put more strain and require more force. That's going to be a chance where you could potentially injure it more and worsen the problem. So it's definitely something you factor into it, but we never outright restrict people and say, nope, sorry, you can't.
Because you're saying maybe some counseling about what types of engagement are less prone to potential injury or buckling or whatnot, depending on the specifics of their curvature.
Yep, exactly. And they'll know. I mean, there's that sense of anxiety when something's about to be bad, and so they're aware of that.